Hello.
Hello.
Hey everyone. Thanks for joining us. We're gonna wait a couple more minutes to let people in, but we might start with just mutual introductions between all of us, and then um, I will introduce Dr. Levasseur. So let's see, is any Raj or Brenda or Arlen? Maybe Arlen, you should go last so people have the benefit of hearing from you, the founder of SOAP. If possible, Raj, Gaith, Brenda, quick, and we'll just start that, and then we'll go to Arlen, and then I'll introduce Emil. Go ahead, Raj, please introduce
Hi,
yourself.
Raj Shankar here. I think I'm the newest member to join. Just spoke to Dr. Arlen recently, and he was kind enough to introduce me and guide me to the next steps of being in the group. I'm a trained physician from India, but I've done my internal medicine residency here, but chose to pursue entrepreneurship route. I call myself a healthcare startup navigator. I do anything from fundraise to scaling up to operations, pitch deck, marketing, branding. And I especially like branding physician founders. Currently, I represent eight startups. And I'm looking for to raise 1.5 million for two projects and a 5 million for another project, which is basically a drug delivery thing, a drug scaffold, which basically use generative AI. It's been validated by Penn State and Harvard already.
Oh,
Yeah.
well, nice to meet you. And then
So,
Brenda, and for everyone that's joining, we're just doing introductions of all the participants first, real quick.
mm,
Great. Hi, everyone. I am Brenda. I'm a internist and pediatrician in Minnesota, and I found out about this webinar. I was going to join the all-in remote cohort 6, so that's how I found Emil's webinar. So,
Okay, awesome, great. Maimuna, are you able to speak right now?
Hi, it's Mimina here. I'm based in Dublin, Ireland. Apologies, my camera isn't helping me. I'm founder and CEO of Telligence. I'm a medical doctor. I've spent last 15 years in clinical education, and my startup is about an infrastructure that we have designed for clinical training and assessment that can be scaled globally. So,
Okay, very cool. Well, thanks for joining us late
thank
at
you.
night. And then Justice Boyce just joined us. Justice, if you could introduce yourself real quick. We're doing round of introductions, if you're able to. You might not hear. Oh,
Hey,
there we
can
go.
you hear me?
Yeah, we can hear you.
Awesome. Sorry, I'm walking home. So I work in the I'm in the private equity space. Always had an interest in healthcare, focus on the middle market transactions. Had a friend recommend that I join SOPE a few months back. So looking forward to the conversation and being involved.
Awesome, fantastic. And I think I did see Gaith earlier, but I don't see him now. So, well, let's let Arlen introduce himself, and you all should know that this is a. Well, I'm glad to see you, Arlen. Haven't seen you in a long time, and not just you part of the SOAP DFW chapter meeting here with Emil, but you also have one of the founders and principal person of SOAP here of the international organization. So Arlen, thank you for joining us.
Yeah, thanks for having me. And for putting all this together and for your leadership with the chapter. So I'm Arlen Myers. My first career was as an academic head and neck surgeon at the University of Colorado, and then I wound up doing what I'm doing now. We created SOAP in 2011. So thanks for your interest and whatever we can do to help you get your ideas to patients or connect to people who can help you, let us know.
Fantastic. Thank you. And for those of you who don't know, who just kind of came in and don't know much about SOAP, not just is it the organization that Arlen started, I only run the Dallas-Fort Worth chapter here, so this is put on by the Dallas-Fort Worth chapter, but it's still soapnet.org, right?
Yeah, it's www.soapnet. I put it up in the chat.org. It's only $80, and believe me, you'll get a lot more out of it than $80.
So please, if you're interested in this organization, this is the way to the chapters. You join the international organization, and then you gain access to the chapters through that. So once again, thank you for joining us. And since we don't have anybody else joining us, then real quick, my name is Hubert Zaitchik, and I started the DFW chapter a couple years after SOPE was founded, I believe. Maybe it was 14 or something. And we tend to have quarterly meetings. Actually, 10 years ago, it was much easier to get a few people around in a room. But since Zoom and the pandemic, it's gotten a little harder. Also, Dallas has grown a lot, and so this is a little bit better and easier for people to navigate. In my day job, I run Health Wildcatters, which is a healthcare seed accelerator and seed fund. So we invest in super early stage healthcare startups of all kinds. So as a trained physician myself, I promise you a dream job to have all these entrepreneurs around us all the time. Emil is also a mentor at Health Wildcatters, and has been a great addition to us. But here, I want to introduce Dr. Emile Levasseur to you all, who is our, I will do a fireside chat, imagine flames somewhere in the picture with him. And Emile is, and by the way, it's not a misspelling, it is with two L's. And it's a French name, but he's from Puerto Rico. So Emil is a physician in internal medicine and obesity medicine. He's a telemedicine clinician and advisor and a fractional medical director for telemedicine companies licensed in all 50 states, DC, and Puerto Rico. He's the founder of Salud Health, a Spanish first national telehealth platform currently in pre-launch infrastructure build, designed to expand equitable access to care for the 62 million Spanish-speaking population in the United States. He's also a founder of Impact Plus Capital, a passive real estate syndicate with social purpose, and a former chief of medicine, regional medical director, and physician advisor at Advent Health. So with that introduction, we will also, by the way, use just a system where you just raise your digital hand so I can see you, and please feel free to ask questions along the way if interested. We have one more person who just joined us. Gaith, if you don't mind quickly introducing you, everyone else has already, but Gaith Ibrahim is also a physician here in the Dallas region. If you can, if you're working on a patient this moment, then don't.
I just want to mention that I put in the chat again that we're sponsoring, that is SOPE is putting together with one of our members who runs actually our Puerto Rico chapter. He's putting together an AI conference in September in Puerto Rico. So if you're interested in participating or speaking or sponsoring or whatever, let us know. You should also know that the Chicago chapter is hosting an event as part of something called Manasseh, which is Middle East Southern Asia Summit. And basically, it's a 2-day conference in Chicago, the purpose of which is to include non-white male clinical trial subjects in clinical trials, particularly from the Middle East and South Asia. So I've heard some things where there's sort of overlaps, and I just want to mention that. So if I put my LinkedIn, and probably most of you know how to get in touch with me, but I'm happy to send more information and connect the dots.
Awesome, thank you. It looks like Gaith has not connected with audio. So we'll just move forward with my first question. Really, I just wanted to lead in, obviously, your Puerto Rican background, trained internationally before practicing medicine across the United States. So kind of tell us a little bit how that journey has shaped the way you think about healthcare And Gates is just texting me that he's not able to join the audio this moment, so we'll maybe introduce him later. Go ahead, Emil.
Perfect. First, thank you for this opportunity. Thank you, everybody who was joining me. It's really a pleasure to me to be here and able to kind of give a little bit back about my experience and everything has been going this journey that I really love. I'm one of those doctors have a lot of passion what I do. I'm not those burnout doctor, and I enjoy everything that I do. And one thing that I'm this stage of my life is definitely giving back. So this is definitely a good forum for me to do that. And I think everything comes back with my background. Actually, I'm from the Dominican Republic, the next island, next to Puerto Rico. So basically, it's a third world country. We didn't have anything. My father actually was a physician who really dedicated to his patients, and I always saw that since I was young. He used to work significant hours. I never saw my father and everything because he was just working. And actually, that's what keep into my mind that I wanted to be a physician, but I want to be a little bit different, a little bit smart into that to be able to really divide my time. And that's how my journey comes into place. So after I finished medicine at the end of 2010, actually I was going to go to Spain to do my specialty because actually I didn't know English at that time. So I decided to start studying English in 2011, January 2011, and for the USMLE. So it was a big journey for me, learning English, studying for this difficult exam. Quite different, but I think that's why I always say that I like to take risk. I'm really risk taking. I think it was a big risk to try to learn a new language, plus definitely go for such an important exam. At the end, I made it, and I think a lot of things that I learned, like all the process that we take for granted, and that transition coming here even without anything. I remember I came here with only $1,000 in my pocket in 2013, and what you are able to build when you don't have anything, change your mind and continue growing. So that's kind of background thinking, my journey, and how I continue pushing hard to be a better version of myself.
Well, first of all, apologies, Dominican Republic. You can call me German from now on, which is a great insult to an Austrian. And I think hopefully it wasn't. I got my lines crossed. I had both on there, and but
yeah, I'm licensed in Puerto Rico. That's why I know it's
yeah, I saw that.
Not everybody's licensed in Puerto Rico, and I work in Puerto Rico.
I'm directly across it. Apologies. And actually, interesting because you probably don't know this, but I grew up with my dad being a cardiologist, but he also did house calls. So he had his own private practice in the same building we lived in downtown Vienna, and I learned driving the car by bringing him to house calls. And if my dad was on vacation later on, like his patients would call for something, and I remember like bringing one of his longtime patients food. She couldn't leave the house, so I ended up going shopping for her because it's a family thing. It's like you live with these people, you get to know them really well, and it's a lifestyle of connections, not the transactional piece, but really their lives, and you get to know them really well. However, the realities in the United States are a little bit different, maybe all across the nation now, across the world now. Many physicians feel frustrated with the system, but few decide to build something new. So was there a specific moment when you realized you wanted to do entrepreneurship? Was it like a moment, an epiphany, or was it like gradual, or did you see somebody do it and you say, oh, I want to do it too, or a frustration?
So I think for me it was time. At some point, I always wanted to grow, and I was growing within the healthcare system. That's why I did like a fellowship in healthcare leadership, and that's when I became regional medical director, and then chief of medicine. I think it was chief of medicine with like 30 something, 32 years old. I became chief of medicine, kind of very young age into that because I have that growth. But then I remember in the living room of my other house that my daughter told me, when are you going to be playing with me? It's like I felt that I was achieving everything. And suddenly, like what was really important for me, that is family. For me, I can leave everything. For me, family is the most important. So it's just when you realize, okay, I have to do something different. I cannot only change time for money and just kind of do something bigger that actually be able to fulfill myself, diversify myself, and then actually um, because I at that time I was very comfortable and I forgot that I like to take risks. But at the same time, when you see all the taxes and things that we paid, the big solution when I started was my real estate business. I decided to definitely educate myself into all of this. It's super important to how we can diversify. The tax law here is for business owner and real estate. So in order to be able to decrease all the tax liability, I went ahead and definitely start first my own portfolio of real estate. And then because I was very successful on the real estate part, a lot of people were kind of asking me like, how you're doing? How you're doing this? I was actually unconscious teaching a lot of people how to do that. And I love always to give back. But sometimes what I realized that some of the physicians, they don't have the time to sometimes learn. I'm very passionate everything that I do, but some that very kind of focus into all of this. They like the clinical part, which is okay. It's not for everybody. But in order to diversify, that's why it says how I can do something bigger and helping bring kind of all the physician with me, and also join to my why. At that time, my father was diagnosed with dementia, and we were kind of after being really leader, he was the chief of dermatology of the army in the DR, and after COVID happened, he went down. Was a moment for me was very, very difficult to navigate since I was in the United States and my mother was there with him. And we realized that in the Dominican Republic, there is not something like assisted living facility. That doesn't exist there. It's very difficult to get really help, even at home or in assisted living facility. Patients with dementia really suffer a lot in the Dominican Republic because of that. So one of my big goals that I decide that I'm gonna fully open um, assisted living facility for free in the Dominican Republic. And the vehicle that I decide is I'm going to make sure that with my impact plus capital, we're going to give good return to all my investment. But actually, I donate everything to assisted living facility back home to be able to keep and give that to kind of people with no money with dementia. We have an agreement with actually with a church place there that I donate everything. For me, this is not about the money. It's about how you fulfill yourself and giving back. So that has been a very fulfilling. That's why first I'm able to help physicians who really want to get good deals. I partner with really good syndicator to also have really good deals. And at the same time, I'm able to give back to my country, which I think it definitely not all about growth. It's about what you do with everything and fulfill your needs. So that's how actually how change things and Impactful Capital came into place on my real estate part.
Okay, wow. That's and so you did you say that all your real estate doings, the
No,
private
my personal is mine, but the syndication. I have more than 400 units apartment, like a apartment building with investor, and as most of you know, when you are an investor, there is a part that is the initial putting the deal together and the fees that you do monthly. All that monthly fee and everything, I donate everything.
Oh wow. And are
After
those
I
in the
spent,
United States or they're back in DR?
sorry.
Are those units in the
No,
US?
here. Yeah, US,
Oh,
Indiana, Houston, all the 400 units are in the US. All my investor physician are in the US base. So yes, I want to make sure that they get good return, but from the fees that normally a syndicator will actually bring to their pocket, I donate that.
okay. Oh, that's really awesome. Wow. That's a big help. And so actually I just wanted to ask a little bit about your practice and kind of I mean, you're an entrepreneur, you've got a pretty deep why and an observation there, but you often say physicians should be on the front lines, shaping the future of medicine. I mean, not everyone can become an entrepreneur, right? We still need a few to also do the doctor thing. But what kind of what's your why do you think it's important that doctors pursue entrepreneurial ventures like this or become entrepreneurs?
Yeah, I think it's super important. I understand that you can be clinical, but I always say that there should be some percent of you that needs to be involved in the admin side, in the work side. Because nowadays, in the admin side, if you are not there, you're not shaping the future. And I think you have to put the patient first if you want to be successful in the long term. Yeah, some admin side will be able to decrease costs and all of this, but they are not putting the patient first, and that's how things fail. But I think if you advocate for your patient, if you are there and you're creating models that definitely make sense and working with admin to be so sustainable, I think that's the only way we're going to be able to this high spending, non sustainable healthcare system that we are having now to something more sustainable and make sure that also patients are taken care of. So I agree that not full time. Not everybody should be kind of an entrepreneur, but I think is giving that combined area that you give something to really have understanding, not say, I'm not an admin, I don't care, I'm gonna do that. That's definitely you're gonna be failing. And this is kind of if you want to be in the future, if you want to continue growing, and if you want your healthcare system to support you, I think you definitely will have to kind of work with them to continue growing. So that is definitely my take on that.
I mean, you're still also practicing medicine and building Impact Plus health, capital and Salute Health. So I mean, how do you make it work? Is this sustainable? Can you make it work? Is there more than one of you? Is this the real Emil? Will the real Emil please stand up?
So I think it is. I'm pretty good in system, and I think that that is what happened. That we sometimes think about and struggle to do some things. If you're really good and documented system, delegate, and have a clear vision what you want, you can do it all. Sometimes we as a physician have the hat. As I said, I'm only physician, but I have my hat that I'm an entrepreneur. I'm a father. I'm a husband. Definitely. For me, that's something that is super important. And that's why you can design your life the way that you want it, in the sense that am really good in a schedule. So I'm really tight a schedule that I can be everywhere that I want and be super efficient into what I'm doing. Like I have my time block. First, I block things that I want, like my time to go to the gym, my time to pick up my daughters and get to school. All of this is blocked before I put all my meetings first. So because if you put what you want really first, definitely you're really happy and you're more productive. If you're burned out, you're either not doing your job well and also your family and your personal things definitely destroy. But for me, it's the opposite. Putting what I want first, even though that sounds like, oh, you have things to do. Actually, no. In the time that I'm fully off or focusing on any other activity, I'm more present of what I'm doing. So that's why I'm able to divide really well my clinical time, my admin time, and I have a schedule for the next month, every single thing or every single company that I'm working with very well in my calendar, my master calendar. And of course, I have a really good assistant. I delegate things. If there is something that doesn't need my expertise, it's better to delegate because it's impossible for you to build everything by yourself if you're not able to really delegate things and able to help you implement and go better. I think sometimes as a physician, we are used to, I am the best, I'm the only one, I'm the genius into all of this, and I make all the clinical decisions, I don't need anybody. And that mentality should not translate to your personal uh, life because that actually is not going to get you anywhere. Actually, it's the same, it's the opposite. It's to be a team sport and be a good team sport, you're able to accomplish more things at the same time.
Okay. Well, okay. Well, let's dig into a little bit into one of the two businesses, Salute Health. What problems are you solving and why do you believe it hasn't been solved yet?
So, Salud Health, I first started working with many telemedicine company, and some of you that join now, I'm a national license. I have license in every single state. So it's very attractive for all those telemedicine company to hire me because I can cover the whole United States anytime. So I work for many of them. So I understood really well the system and I became advisor to many of them and fractional medical director. But a lot of those companies were hiring me because I actually, my first language is Spanish. So when I see all the struggle that all the Spanish speakers were having and the joy that they were having when they speak with somebody who really can understand not only the medical part, but also the culture, I just realized that why not pursue something to take care of all of that? Why not going definitely bigger into all of that? I have all the process, all the connection, and a really clear vision. So, and then I know that a lot of his English speaking physicians really they don't want to. I don't want to say they don't want to take care, but it is more difficult. It's more challenging. Let's just put it at that. But if we create like a virtual platform that we can take care of most of the things that they definitely will need nowadays, the technology and things that we can do to telemedicine is after COVID, everything was kind of accelerated and all the permission things that we can do. And people realize that you really don't have to go to urgent care for a UTI and spend 5 hours to get that antibiotic or the flu-like symptoms to get things. So there's a lot of things that we can do through telemedicine while this population works a lot. So you can be working, having a telehealth with us 5, 10 minutes, and then you get what you need and you continue. Your life is not interrupted. And I know that be honest, elderly population may not be suited to the telemedicine, but the millennials, the younger population, it's the Amazon effects. They just want the care, they just want it now, and they just want a response now. I think that's what telemedicine is coming from. And you want or not, will continue growing because that's what the people, the next generation is asking for the physician. Good customer service that is fast, that is reliable. Of course, with really good protocols. I'm very picky in compliance and protocols. I don't play with that. I talk to my attorneys almost weekly just to make sure that part of the compliance piece and having good protocols to make sure that we deliver a high quality care when people need it. And that's why basically I create Salud Health. So we are pursuing that segment of the market that is very underserved. And we are planning to create a more like a virtual. The goal is to create a full virtual healthcare system for the Latino population where we can cover almost everything.
Okay. So you're in the build phase and bootstrapping the company. I guess, I mean, what's the most challenging part so far, or what do you most, I mean, what do you think will be the hardest coming up with?
I think that the hardest is that for me, it's a different mentality. And I'm going to say my example as a physician in the sense that we are used to work by itself and a lot of things, yes, has been kind of evolving in the team sport, but definitely delegating and creating the team that I can trust to do all of that and sometimes fail, like the tech side in the background, creating all the EMR and all of this has been a big challenge and time and takes really time because I'm in the clinical side. I'm definitely really, really good. All the protocols, everything is definitely in place. But creating that background and creating the marketing, all of this has been taking a little bit more time. And we realized that we want to launch at what time. Sometimes it's not what you really want. And entrepreneurship is like that. You have to trial and error. It's not gonna be perfect. Launch always will be delayed, and you have to be okay with that. At this time, yes, I bootstrap because I want to have at the beginning really well control and launched company. But yes, in the future, I think if I want to go bigger, I need to kind of bring expertise, an investor that can bring some value to go to the next level.
So has any of it been most difficult for you? I mean, the tech side or?
I think that the tech side, kind of building everything in the background to make sure that everything flow. There is a lot of errors in the EMR. I mean, now we are perfectly fine. Well, there was a lot of error things that were not proper. I'm also a person very detail oriented, and I like really well workflow and automatizations that needs to be really perfect to decrease time. I don't waste time in my life for everything. So if there is something waste of time or something that we can do, I will always push. And if you see, when you see all the workflow that we're having, it is very easy for a physician to see if it is like a like asynchronous televisit, where a patient will just fill out a dynamic questionnaire that will be asking. If you answer this, we'll ask another type of question. It's not AI, it's actually built in that part. Once I receive that questionnaire, I can actually real quick, everything is flagged, what is red, what I don't want. I do create all the red flag. So I can take a medical decision within 10 seconds if the patient will need something or not because of the workflow that we are putting. So the more patient I can see, less time of me, and I can decrease the cost for what the patient is gonna pay. So at the end, creating that has been more challenging because I want to make sure that it's really perfect and decrease time. And we are able to also have all the safeguard for me to make sure that when I'm prescribing, patient get the care that they need. So that's kind of been my big challenge on that so far that we've been having.
Well, and by the way, I know we're got plenty of questions here still, but if anybody has a question, just raise your digital, usually it's a yellow hand, and we'll let you ask a question because we want to have that. Well, there you go. Raj, go ahead. Oh, do I have to unmute you?
Okay, no.
There you go.
Yeah. Have you considered like local patient navigators or caregivers or home care agencies to implement? Because I used to run a home care business.
Definitely, that's like a 2.0. Remember that I'm more like a national company, and we're kind of launching into that. And that was a challenge that many company for me because of my experience. But actually, that's a really headache to be a national company and be compliant with the like, professional corporation, the MSO structure, and be foreign qualified to every single state and be compliant. Yes. So that is why we at this time, because we're focused more in the digital space, I'm not centering into that. But as we evolve, yes, the plan is to have kind of in-house and better routes specific that we actually have the zip code where most of the Latino live within United States. So we're going to be targeting those specific area. And that's part of kind of the evolving plan that we do have after launch. But yeah, we want to get that in Spanish, like that's the promotora, so we call in Spanish, and that's part of the plan that we are having. Yeah, I think that's a great idea.
Yeah, there are a lot of national franchises like let's say Visiting Angels, Senior Helpers, like that. You just partner up with one. They usually have zip codes everywhere, and it's very easy because they are already compliant for the state.
If maybe we can contact offline to kind of know more, I will definitely will love
Yeah. You
to
can
have
talk to me. I had run an agency, and I can connect you to the right people.
Yeah, thank you. I appreciate that.
Yeah, thank you.
Good. Yeah, awesome. Well, I mean, since we are on that, and you mentioned all the barriers you ran into, so in innovation, obviously, regulatory complexity is a big deal. I mean, are there any particular guidance you have for physicians on the regulatory side before starting a healthcare company? Things you have learned, or that you are really, a stickler for, that you believe is essential. So any advice along those lines for anyone starting a healthcare company?
Yes. So the first advice that I'm going to be giving that you have to know if that company is delivering healthcare under your name, that you only want to do healthcare, like a professional corporation will be more than enough. But if you're planning to grow, get investors, or anything that you will have to create a PC MSO structure, like professional corporation with an agreement with a management service or organization. Because the professional corporation cannot get investors and basically you cannot sell that PC. It's just a medical service. You are the physician, you are only the owner, but actually it's not attractive for any kind of, actually there is no value in the medical group. That's what we call medical group. There is no value at all. So if your goal is to you as a physician give your service, you can have your professional corporation, you give your service, and that is perfectly fine. But if you want to sell, then that's when the MSO comes into place and you have to have an agreement. The MSO could be whatever, Delaware, whatever you have, only that is okay. That's kind of the management and that's going to be the one that you have to have really good operating agreement to see That's what we see about getting all the investors, and you're gonna do all the seats, and everything goes on that. The point is that that's to protect the corporate practice of medicine. That is a specific, most of the state actually, you have to follow the corporate practice of medicine. That technically a investors outside of physician cannot practice medicine. And this is kind of the way they work around, where it's a divided roles between you have the MSO, who is the one, the marketing company and everything company, and then the medical group is actually the one that is actually giving the patient care and practice medicine. So my advice is, if you're gonna thinking in selling, if you're thinking in actually raise capital and all of this, make sure from the beginning you have the PC MSO as a structure. The other part it is that if you're gonna go national, make sure that you foreign qualify that PC to every single state. But there is actually certain state that actually you cannot foreign qualify a professional corporation. That's the California, New Jersey, New York, Kansas. Those are the ones that you actually will have to open a new one. And if you go national, you will realize that you will have like 5 professional corporations with 1 MSO, and that legal structure between all of them, yes, can be really expensive, and you need to have very good healthcare attorney who able to understand, because it's all about the flow of the money of the corporate practice of medicine. If, for example, all the money should go to the professional corporation, and then you need to have an agreement that, and cannot be a percent, you need to have a flat rate that all the money will flow to the MSO. That is basically you're kind of paying for all the service and everything. So there's a lot of legality into all of this. So you have to be very, very careful when you're opening a full national telemedicine company. That's my main expertise, if you want to be compliant.
Okay, great. A lot of what we do here is about connecting people. And since we've had 3 more joining us, let's just take a real quick second. And Gaith and Paloma, and I don't know whose iPhone, maybe you do a real quick intro. SOPE is about meeting other people in the physician space, whether you're a physician or just a professional in healthcare. We'd love to at least make sure everyone meets everyone. Paloma or Gaith, do you want to unmute yourself real quick? And
Yeah, sure. Hey, it's good to hear from you, Emil.
Hey,
and thank you, Hubert, for putting this together. My name is Gaith. I'm a hospitalist. I'm an internist. I work with Baylor Scott and White, Sunnyvale. And I got a question once Paloma's done with the introduction.
we'll
okay.
bring you.
1 second, then maybe Paloma and Mr. and Mrs. iPhone, or Dr. and Dr. iPhone. Are you able to introduce yourself?
Most likely Paloma I know Paloma. She's actually one of my best friends, excellent physician from North Carolina, hospitalist. Most likely she's with the 2 beautiful daughters right now. I know them very, very well.
I have daughters too, so it's okay to get
Yeah, sounds like she's with them.
Yeah, you can do the
yes.
introduction. And Mr. and Mrs. iPhone, just as a point of order here, please speak up or I will have to remove you, because we don't do anonymous participants. Please, whoever's on iPhone, since I cannot see who you are, would you please just
Yes, sorry. I was actually trying to dial in on my computer so you could tell who it was. This is Tracy Berwick with Precision Health TPA. And we're a TPA that a third party administrator, if you understand what that is building from a fiduciary first perspective, meaning that we are only working with independent entities that aren't owned by a major carrier or someone that would dictate how they run their business. So we're looking to make sure that we're able to track every penny in the best interest of the employer and the employee in a self-funded health plan, which obviously telemedicine is a big part of.
Awesome. You, Tracy, and welcome, and also Paloma and Gaith, of course. That said, Gaith, you had a question?
Yeah, thank you. Emil, I think you spoke about regulations and compliance. If you could share with us kind of what are the newest CMS kind of rules for telemedicine, There was, I think, a ruling before about seeing the patient, especially with continued care, that you have to see the patient physically at some point. Is that part of the solution that you're working on, or those rules have changed since then?
So yes, in telemedicine, there is a lot of regulations, and I want to divide those. So we're talking about Medicare, Medicaid, that's one set of rules. You have insurance with one set of rules, but there is actually a big part that is actually cash-based. And a lot of the telemedicine actually that is growing is cash-based. So technically, there is no, I don't want to say there is no restriction in the cash-based world that you're able to do, and that's a specific what is growing. And people, even that they have insurance, they're willing to pay in the cash base because they can get fast, reliable care. And there is a lot of niche company like for obesity, now the longevity worlds and all of this, it is growing a lot. And I move myself a lot in the cash-based world. That's kind of where there is a big opportunity on the telemedicine side. And then you have the insurance part that they do have less restrictive actually regulation than Medicare, Medicaid. They continue paying for that. It's a little bit lower, but actually they admit, and actually they are having agreement with those that previous used to be cash based. They have an agreement to offer a zero cost, specifically more urgent care to all the all their clients, because for them it's going to be cheaper to have a telemedicine rather than all their clients to go to urgent care and expand or emergency room and having that big of a spend. So in the insurance part, that will definitely continue growing. In the Medicare side, this is when all the restrictions CMS definitely is coming, that they kind of keep changing. I know that at some point they didn't want to do telemedicine. That definitely now is the push back into all of that. But the way that I see in the CMS and everything in the government, to be honest, they lag behind a lot, and sometimes they don't understand the new trend. And once they do realize that, they keep changing. So even though that maybe, yes, those restrictions now I think definitely will open. The same happened with the DEA, with controlled substance. During COVID, actually, they have to put that exception that you're able to do prescribe controlled substance. Even if you have only one DEA, you can able to prescribe nationwide, and you do not have to have the first encounter with the patient live and then follow up. So that restriction, still they keep pushing every year, even though that every year they say that they're gonna come up with some ideas. They give a proposal that me as a physician, you can actually do the EA and prescribe substance to in any other state, but you have to check, we call PDMP, that is to check if that patient was prescribed really an opioid in that state, and you have to document that you check. But the DEA wants you to check every single state, and they are not united. So they expect us to check 50 PDMP to prescribe that, which definitely doesn't make sense into that. So all this government regulation, yes, we have still an exception, and we should wait for the end of the year where they will come up with a more general DEA. I understand the restriction, and during COVID was a lot of abuse of opioid prescribing. I understand where they're coming from, but they need to definitely adapt, because big company like the Hims and Hers and Raw and all of these are changing, and more people are involved in the telemedicine. So if you go, I always go to the American Telemedicine Association, who is a big advocate on all of this. And all the attorneys says that be tuned into all of this, because there is a bit advocacy into that to change those parameters. So even though that what I believe, even now, they're thinking some restriction, I think soon you will be more likely implementation, because it's just more convenient. Medicare patients, they're very old. They cannot move. Where I used to live in Florida was a small town. They used to our patient need to travel like 2 hours to give really specialized care. So it's just impossible for elderly patient, Medicare patient to be driving so long when something that can be resolved in 5 minutes, 10 minutes telemedicine conversation. So yes, I understand your restriction, but I think things will be changing. And I think most in the telemedicine space is preparing for that change. Now they created the access program. We did access is more for other things that they want AI implementation, they want behavior implementation. So they're trying to modernize a little bit. That's a new program that Medicare is saying. So I think there is hints of changes that will be more adapted to try to keep the patient at home more than trying to bring the patient to the hospital or the clinic. I think where there is going, but as you know, government things takes forever.
Well, actually, that was kind of in the direction I was going with the next question on where is it heading, telemedicine in the next 5, 10 years. So if you just go beyond the year, obviously you just mentioned the end of the year, but I mean, I suppose you could take it either way. As an ideal scenario, how would love to see it develop, or what do you think realistically will most likely happen in telemedicine?
So the future of telemedicine, again, is what I mentioned. I think will definitely continue growing. People really want now the younger population. That's what they want. They want telemedicine. They don't want to spend hours and hours in a doctor's office. I think the way that I say that more implementation, there still will be a lot of cash-based company that will continue successful, like all the agreement, HIMSS and HERS and RO, I already mentioned now with the Wegovy pills and everything, continue kind of growing those agreements. GLP-1s and will be leading telemedicine, now the longevity space with peptides and everything like that. Women's health now has been growing, and HRT, hormone replacement, and that part, women are using a lot. That is the same with men's health. It's continuing growing a lot in the telehealth space. And so there is a new trend of like human optimization. I think telehealth definitely going into that. And then I see also the part of the clinical care, the urgent care. I think definitely telehealth will go, and I think will be more in the emergency when you really need any kind of procedure, things like that. That's when you're really going to need. We'll be decreasing as much as we can all the workload for all the hospital, because people still don't believe a lot, and there's no while available. But once they understand, it's like before everybody used to go to the ER, and now people understand urgent care and an emergency. Before used to be no, what is urgent care? I don't know. Everybody really knows, and they know they pay less if they go to urgent care. Now, when they know they're going to pay even less or maybe nothing to telehealth and it's well available, I think we'll continue into that. I think so. Medicare says will continue implementing and increasing insurance already adapted. And what I'm going to see is now it's very delicate into that because it is like those big pharmaceutical are having an agreement with telemedicine company to have like a full cycle into that patient gets some medication, gets the prescribing. And also in the background, now they're forming white label telemedicine company that you actually, there's like virtual medical groups where if you want to start like a telemedicine company, you have those white label EMR, white label actually medical group, a lot of physician in the background that we can help kind of plugging in all those actually telehealth. So people may not know, but like the Walgreens telehealth, the Amazon, the Walmart telehealth, and CVS, actually it's the same physicians who power everything in the background. There is actually those big like real medical group that is the one who powers all of them. And it's just the same physician, the same things. They just put a face. It's unifying things in the background. I think telehealth is going vertical into all of that. And the other piece it is national licenses that I think that I see that as a physician, I have the what we call compact license that will give me like 40 license, but the rest actually I have to go each one of the states. I see that the compact license will be national. So it's going to be easier for a physician to be national licensed than what is now. And another things that we know is like that I was reading some study that by 2045, the amount of physicians, nurse practitioner and PA is going to be higher than physicians. So also we have to look about national license for nurse practitioners and PA that is going to have a big role in the workforce of the healthcare system. And they actually, it's more difficult for them to get national license than the physician. They do have nurse practitioner, they do have a compact, which like 10 states still in the infant phases. So I think making things more national. I think that we're heading that way for both sides. Regulations will continue hitting that, and then I think it's just again, it's just the future of non-surgical, non like hands-on things. Everything will be done digital.
Okay. We are in the last 8 minutes, so I want to make sure that anybody who wants to ask a question has a chance to ask a question. Just raise your little yellow hand. And if not, I've got plenty more questions. The first one is really around making mistakes. We all make mistakes. You've been around the block as an investor, as a startup entrepreneur. What lessons have you learned building your first healthcare company? What can you share? How bad did you screw up, Emil? Spill the beans. Spill the beans.
Yes. Uh, my first mistake is thinking that I can do it all and I can learn, even though that I learn a lot. But I think what I need to learn is to have better understanding, not to do things. So really outsourcing to the right person and betting to them is able to go further and they can actually give you better advice. So I'm one of the person that now I definitely pay for a good lawyer and I don't care what it costs. Paying for somebody with experience in operation and I don't care what it costs. Paying somebody with marketing rather than trying to put a logo, definitely you have definitely better quality. For example, my licenses, having somebody who manage, because it's impossible for me to manage all 50 licenses. So I have a licensor who takes care of all the 50 licenses into that. At the beginning, I wanted to do it all. But when I realized that outsourcing and trying to focus in what is valuable is when I see better results and everything was aligned and maybe better that I was doing by myself because they bring a different angle. So I think, and even in the whole my life, I being a big believer that having mentors, I'm a big believer having coaches into that, bringing that expertise, that years of experience compressed in several hours. That's also I like to read a lot of books because you have like 20 years of experience of something in one book or having that person life. I think is very valuable and trusting that person and just going to the next level. I think is something that I think has been very big lesson that I learned, and now I don't care and I pay for that because actually it cost me. It's the opportunity cost. Like my company should be launched long time ago and has been delayed because all of that. But now that I brought the right people, we are basically launching in 20 days.
Okay. All right. Well, actually, Paloma is sending a question here. Thought about AI substituting this process of telemedicine in the future. Do you see it as a tool as a replacement of this process? As in inpatient hospitalists, I'm seeing the shift of more APP versus provider ratio.
That's a really excellent question. And I have a different view into all of this, and maybe I'm a little bit more realistic into the future of medicine and a very really health tech in the space that I'm not gonna say, yes, I'm a physician, nobody will be replacing us and we are the best of the best. No. To be honest, it's about efficiency. New actually AI algorithm our physicians are 90% correct and AI can be 98. So they will be, and they're becoming more better and better and better. So will be a point that even in any lawsuit, it's like, why you did not use AI for this patient because you have a higher risk of actually error than AI per se. It's still we're not there yet. Although this is gonna be the standard of care of running things through the AI to make sure that we are 100% sure in the best interest of the patient. So I see that a problem in the future, like yes, this is the standard of care. It's like, uh, let's put like that now, like electronic medical record that definitely decrease all the errors. Like we don't use paper anymore. So if you use paper and things like, yeah, that's something of the past. The standard of care, you're definitely used to that. Now you have to do like in your same EMR, you have like a drug checker and all of this. You have a lot of process in place that's the standard of care now. If you're not using all of that, you're liable. So I think that's how AI will evolve into all of that. Regarding APP, to be honest, is two reasons. First, they're cheaper. Let's just be realistic than a physician in the workplace. So pairing AI plus an APP in the safety definitely increase significantly the productivity and the actual reliability of the care that uh, advanced provider will give. And then you have the shortage of physicians, but you see that the curve, if you see that nurse practitioner and PA are continue increasing the amount of the workforce versus decline in the physician side. With that in mind, what I said, I think the future, we as a physician, we have to become the leader. We're going to become the director of the orchestra. We need to be there. We need to be on top of that and manage and be the safeguard of all the clinical context. We may not be the doers. We're going to be the director of the orchestra. And we as a physician need to position in that time. You understand our role. It's a little bit different with how we're going to be evolving in our duties as a physician in the future. So I see myself AI, APP, and a supervising physician, making sure that all the quality protocols and everything into safety in the best interest of the patient. We want it or not, I think this is how like the future is going in the healthcare.
Okay. Very good. We're pretty much at time. So any closing words of wisdom? Anything you want to share with this group on whatever you want to share? It's oh wait, we have another question here. Do you feel that telemedicine, education, remote patient assessment skills should be integral part of medical education, or at least be essential CME onboarding training for physicians embarking on telemedicine service? So very quick question on, should telemedicine education, remote patient assessment be part of the resident education, part of the formal training?
I think, yes, telemedicine and understanding remote monitoring and telemedicine, I think, yes, I agree with you. Definitely should be. I'm a big advocate of education. Actually, I'm one of the coaches that we actually educate physician. I'm part of the All In Remote Academy that we teach physician how to do telemedicine in a compliant way. So yes, that is now we're giving those kind of resources where I think at some point we're going to be certification in telemedicine and things like that. So we want to evolve to really make sure that there is good protocols, that we have good parameters, that we understand that business side and also the importance of that. So that's why actually we teach, and I feel passionate about telemedicine. But I agree, it's the same of like in med school and all of this. There is no business actually. And I think physicians should understand the business of medicine, because they understand better that the reimbursement, the CMS, and all of this, they will a little bit understand the why, like all the admin are doing all of this. And if you collaborate and understand your reimbursement, you're definitely going to pay, decrease costs, and it's cost just a win-win situation. But yes, physicians, we are not very well trained in business, so that's why we are not successful most of the time.
Okay, well, that will be your closing wisdom. Tracy asked whether this is recorded. It is recorded. It'll be a couple days before this will be on. We will edit it a little bit so it's a little bit easier to digest, and also give Emil a moment to think if there's anything he said he doesn't want to record it. I don't think so.
No,
I think this
I
was
know, it was not.
not my usual interview where we have to edit all sorts of stuff out. This is totally about
I try to be nice and just give some value.
Well, let's give you the virtual round of applause. In my case, I'm unmuted, so thank you. Thank you for your donation of time. Thank you, everyone, for joining us. Be inspired by people like Emil. Don't do it home alone by yourself. Find friends, find people who have like mind, get the help, ask for the help. You'd be surprised how many people are willing to help you, no matter who you are, if you're trying to move the dial, doing something in healthcare, improving healthcare, in entrepreneurship in healthcare is, in my humble opinion, one of the noblest things you could be doing. Just shy of being a soldier, a policeman, a fireman. It is, and the first line physician, a nurse on the front lines of medicine. It is a very rough ride. You're putting your own reputation on the line. People doubt you. You have bad days and a few good ones. And so you need a lot of help, a lot of support. Emil, thank you so much for sharing your story and your wisdom. Thank you, everyone. We do these once a quarter. Also, go to healthwildcatters.com. There's a ton more things we do in health innovation, not just for physicians and in other areas of health innovation as well. So you're most welcome to join us there at events and or in any other way. So with that said, thank you again, everyone. Enjoy. It's still bright outside. Can you believe it? This beautiful evening, and we'll talk soon. Emil, I'm sure.
Yeah, thank you.
Very
Yeah,
soon.
and I just want to also thank you for putting this together. Uber has been a great experience. Also, if anything that else I can add, please link in, text me, whatever. I'm always happy to give some value. You will have you can find me on LinkedIn. So again, just take risk, go for there, as Uber said. Surround yourself with like-minded people, and I think if we build better teams, we're able to kind of go to the next level.
Yeah,
Have a
and
good
I'm
night.
also a mentor at our upcoming, or director at our upcoming hackathon. So that happens 17th and
Yeah.
18th April at Health Wildcatters. So good night, everyone, and thanks for joining us. Thanks, Emil.
Bye-bye. Thank you. Bye-bye.